Hello, my name is Dr. Sarah Park. I'm a board-certified cancer rehabilitation physician here at Mayo Clinic, Arizona. My expertise is in cancer rehabilitation. I'm here to talk with you today about cancer rehabilitation and prostate cancer. Some men with prostate cancer experience side effects such as incontinence of bladder or bowel or sexual dysfunction. Some also experience pain in the pelvic floor region or swelling. Often, the best treatment for these side effects of cancer treatment is pelvic floor therapy. Pelvic floor therapy is often delivered by a physical or occupational therapist. Typically, pelvic floor therapy includes multiple elements. It can include education about your pelvic floor anatomy and your core anatomy. It also includes elements about your hygiene and how different practices might impact your continence and sexual activity. Pelvic floor therapy can also include exercises to help strengthen the pelvic floor. This may include Kegel exercises to teach you how to activate different muscles in the pelvic floor. Some therapists may also use manual therapy, which is a hands-on technique to stretch and demonstrate how to activate specific pelvic floor muscles. Sometimes over time, we've learned how to move in such a way that is not optimal for our body structure and function. And manual therapy can aid you in knowing which muscles you're already comfortable activating, potentially what's changed since your surgery, and other muscles that you might be able to recruit in order to optimize your continence and sexual function. Some therapists will also use biofeedback, which is a technique where they insert a probe into the rectum and use a computer monitor to demonstrate to the patient how they are activating their pelvic floor. It gives you a visual representation so that you can then implement some of the techniques that you've been taught in the education and exercise portion of the therapy. Additionally, some pelvic floor therapists will also incorporate electrical stimulation. This gives another form of feedback to teach you how to effectively activate the muscles in the pelvic floor. One of the exercises you may be taught during pelvic floor therapy is the Kegel exercise. This is typically used to activate the pelvic floor as if you're going to hold a ball inside the rectum, or act as if you're going to try to hold in the urge to pass gas. This exercise can be very useful for optimizing the strength in the pelvic floor. Over time, we have looked at many different regimens of Kegel exercises. However, there is not one standard set of Kegel exercises to perform. Your pelvic floor therapist will assist you in developing a program that is most appropriate for your body and your current state. Return to sexual function after prostate cancer treatment is very important to quality of life. There are many rehabilitation interventions that can help with return to sexual activity. These may include pelvic floor therapy, as well as sometimes counseling or psychological interventions. Many patients will report changes to the way that they see their body after cancer and cancer surgeries. As such, often it's wonderful to facilitate a conversation between you and your partner about return to sexual function and any concerns you may have in that domain. This is something that can be facilitated by a rehabilitation physician or by a counselor, depending on your needs. Thank you very much for your time. I hope this introduction to cancer rehabilitation and prostate cancer has been helpful. I look forward to participating in your care and helping you to optimize your function throughout your cancer and cancer treatment and beyond cancer. Please feel free to continue to explore the website and see what our other colleagues have to teach you regarding prostate cancer and cancer treatment. Again, my name is Dr. Sarah Park. I'm part of the Physical Medicine and Rehabilitation Department here at Mayo Clinic, Arizona. Thank you for your time.